Hi, this is Dr. Danaya with Radiant Pelvic Health and Wellness. We're here with Dr. Bryce Brindley at Anderson Chiropractic here in Spanish Fork. So Bryce, tell me what you do here, the type of people that you treat.
Yeah, so we run a pretty full functional family-focused chiropractic practice. There's a couple doctors in our office. I mainly focus on pregnancy and pediatrics. That's kind of like my niche, my specialty.
Okay.
I do see, like most chiropractors, we see everybody. We see lots of like car accidents and personal injury type people. But I mostly gravitate towards pregnancy and pediatrics and kind of help more of that population.
Okay. So what are kind of the main things let's start with pregnancy. What type of things would someone come and see you for while they're pregnant?
Okay, yeah. So as far as like symptoms go or like conditions, a lot of like SPD or just kind of general like pelvic type pain. A lot of what I do is help pregnant patients like prepare for birth. So we focus on like we call them the 3 Ps, the power, the passage, and the passenger. So chiropractic as a whole, we really deal with the nervous system. So we really want there to be a really good brain to body connection.
Okay.
So that's where like kind of that power comes from. So like, for example, contractions, right? Your brain sends down contractions to the belly, and that's how contractions are really controlled. So we want there to be no interference in the nervous system. And then obviously like the passage, that's more common sense to people. The pelvis, right? We want there to be symmetry there. We don't want to have any dystocia during the birthing process. We want baby to have, plenty of room to move around to get in a proper position. And that's where the passenger kind of comes in. So a lot of it is more birth prep. But, pregnancy often comes with lots of discomforts and pains and things like that too. So we help with that.
Definitely. So would you see someone who isn't having pain, but could benefit from this power kind of mindset of like just getting everything ready?
Yeah, absolutely.
Okay.
So like chiropractic philosophy as a whole is if there is alignment in the bones and the osseous structures, we're relieving pressure or interference off of the nervous system.
Okay.
And that creates more expression of life, essentially.
Oh, cool.
So yeah, whether someone has symptoms or not, we want to prevent that from happening. If they have current symptoms, we can usually help them with that. But we definitely encourage people to come see us to prevent any future pains and things like that from happening.
Yeah. And do you ever see people postpartum as well, or is it's just in pregnancy?
Yeah, so the way I kind of explain it to people is in pregnancy, we help kind of guide the body in the changes for pregnancy. As your body is growing the baby, as relaxin is influxing into the ligaments and the tendons of your body, and your pelvis is trying to widen, and you're preparing for birth, we kind of help with that influx of everything happening. And then transversely after birth, we want to help the body kind of get back to more of a normalcy and a post-pregnancy body. So we help guide that process along. They're kind of rare, but there are things that can happen postpartum where people can develop, really locked up tight joints. They can develop more like a scoliosis type things as well. So we want to do preventative things that way, but we also want to just kind of make sure that your functionality and your body is going to work for you going forward. And that's kind of a population that is really underserved, which I'm sure you deal with a lot.
Yeah, definitely. I've seen that as well.
Yeah. So we try to, be there for moms and say, hey, we're here for you as well, postpartum. And, we want to get them back on their feet and, make sure that they are able to take care of their new baby.
Yeah.
And they can also focus on themselves too.
Yeah, I love that. I mean, I'm right there with you. That's the type of thing that I see a lot as well. So I can get on board of just making sure that they can take care of themselves so they can take care of their babies. So you have some specialty training, correct?
Yeah.
Can you tell me a little bit more about that?
Yeah, sure. So I went to chiropractic school, so I'm a chiropractor, right? And then when I was in chiropractor school, we started our own family, my wife and I. And so we had our first baby. And so when my wife was pregnant and we had our first baby, I wanted to be able to take care of them. And I realized that their physiology and their anatomy was different than what we were being trained in chiropractic school.
Okay.
So there's it's called the International Chiropractic Pediatric Association. And they offer a perinatal and a pediatric specific coursework to do and get certified in that. So you've probably heard of the Webster technique. That's specific for pregnancy. So that was one of about 30 seminars that I took.
Okay.
And so the pediatric part of it was about 20 of those seminars. And so it deals more with hey, we're dealing with different anatomy. We don't want to adjust infants like we adjust adults.
Right.
That could be dangerous, right? So it just teaches us all about those differences and specifically more like growth and development. when we're dealing with adults, we're not really looking for, current developing type things. And with babies, we are looking a lot at development type things.
Okay, that's interesting. I don't know really anything about like doing baby care. So it's interesting to hear more about how you would treat them differently with their development.
Yeah. So it's very gentle. First and foremost, I call them just kind of big balls of cartilage. They don't have, fully formed bones and things. And so the amount of pressure that I might use on an adult is much more than I would use on an infant.
Yeah.
So on an infant, the amount of pressure that I use to do the adjustment's about the weight of a nickel.
Oh, okay.
So very, very gentle. Or another way I describe it is if you're checking the ripeness of a tomato, it's about that much pressure. And the purpose of it is just to kind of get a full functioning nervous system, remove any interference so that they can thrive.
Yeah.
So
when you're working with a pregnant woman, do you have alterations as well of like how much pressure you're doing or things that you would or wouldn't do?
Yeah, absolutely. So a common adjustment that people see with adults is a side laying, kind of a twisting adjustment.
For like your low back.
Yes.
Okay.
We don't want to do that in pregnancy. So one, we talked about relaxin, right? They have a big influx of that relaxin. It makes everything much more loose. And so you got to be very careful that way. So that's going to change the amount of pressure you use with an adjustment. But the torsion that a twist can put on like round ligaments, for example, it can overstretch one and not stretch the other. And when you have an imbalance in those round ligaments, when a contraction happens, if one is very loose and one is very tight, you can get kind of a torsion in the contraction, which makes the contraction less efficient. And so we don't want that either, right? So the adjustments that we do, so Webster technique specifically, we're doing specifically with the sacrum and the ilium in the pelvis. So we want the pelvis to the iliums kind of naturally will go to the side and the sacrum will kind of go posterior. We want to make sure there's no interference and, nothing's getting kind of caught on each other that way. But we also do a lot with ligament releases. So I release round ligaments to bring symmetry to them. But we do a lot with other sacral ligaments and things like that to help that sacrum kind of move posterior, just to kind of create as much room as we possibly can for baby and make sure there's just a lot of symmetry there.
Awesome. So when would be a time that you would potentially maybe refer to physical therapy?
Yeah, so a lot postpartum. Big one is postpartum. Definitely during pregnancy as well. If I find, so we check a lot of like muscle tone type things. And if I find that there is very weak muscles or a lot of like functional deficit that is just kind of like either outside my wheelhouse or I just don't have time for, I will definitely refer to physical therapy. Postpartum, that's kind of an obvious one. A mom just gave birth, their pelvic floor is not what it used to be. And there's a lot of rehabilitation that needs to happen there. And so I definitely refer to those, someone like you that would specialize in that type of a thing.
So do you see that fairly often then?
Yeah, a lot. Pretty much every postpartum woman, I recommend that they at least get a consult with a pelvic floor therapist to make sure that they're at least getting evaluated so things aren't just so far gone and, the earlier intervention is the better, right?
Yeah, I love that. Because people get their 6-week checkup, right? But if we could normalize having a 6-week checkup with a physical therapist and looking at all the things that aren't looked at the normal 6-week checkup, I think we could save a lot of heartache and pain and challenges down the road.
Yeah, absolutely.
I love that. Well, do you have a favorite type of person that you like to treat? What's your favorite thing if someone comes through the door?
I love all my patients, but there's nothing like helping kids, helping a baby feed better, helping a baby sleep better, just helping them be genuinely more comfortable. It's the most rewarding thing.
Oh yeah.
It's wonderful. So I probably do favor kids a little bit. And they're just a blast to be around. They're so positive with their energy and they're unique and they make you laugh. And a lot of times in probably your line of work as well, there's a lot of negativity. People are coming to you in pain and discomfort things. Kids, even if they are in pain, they kind of just come in with a can-do attitude and they're very happy and they're just wonderful to be around and to help.
I love that.
Yeah.
So cool. All right. Well, thank you, Bryce, for doing this little interview with me. Is there anything else that you want your patients to know about you or how people can contact you?
Sure. Yeah. So we're Anderson Chiropractic Center here in Spanish Fork. Another thing I do home visits as well.
Oh, yeah.
So I started offering that. I don't do it like necessarily full time, but I do it on the weekends and in the evenings,
Okay.
just to kind of help accommodate people's schedules. So
Yeah.
if it's during like a normal business day or hour, they can come into this office here. And if they can't get in and it needs to be outside those hours, I can definitely come to their home and see them there.
Okay, I love it.
It's more geared towards, postpartum, you just had a new baby type of thing. You don't want to drag the whole family into the office. So in the comfort of your own home is definitely something that us personally have loved. And so I try to offer that and just make care more accessible to people that way.
Very cool.
So yeah, you can reach me on, social media, Facebook or Instagram, and we're here at Anderson Chiropractic Center, Spanish Fork.